With shock from the brutal murder of Nosicelo Mtebeni, another tragedy struck the University of Fort Hare. A student died after falling from a building in a suspected suicide incident. To discuss security, mental health and general wellness, we now talk to Professor Ramneek Ahluwalia, the CEO of Higher Health. A very good morning to you and thank you so much for making the time.
Good morning to you and to the viewers, and thank you for having me.
This is really concerning. Tell us about measures taken to ensure that Fort Hare students can get counseling.
So I think this brutal reminder of what Nosicelo's death has brought into our reality is that as much as a lot of systems and infrastructure we are trying to put for gender-based violence, we do lack in reaching out to every student. And maybe through your medium now, we're trying to reach out to say there are possibilities, there are services available on the institutions to seek help. We can't replace what has happened, but we can save many more lives now. So let me start by just starting with an advertisement of a number. If you can please reinstate this number all the time. It's 0800-363636. This number is a 24-hour call line, totally free. Any part, any time of the day, whether you are in a night time at 2 o'clock or 3 o'clock, when the psychosocial distress is real in front of you, pick up a call. There is going to be a psychologist, a counselor, or social worker waiting to engage that call. It takes about 8 to 9 calls at times to resolve a crisis and then refer to the permanent care or a long chronic care that the person who's suffering from a psychosocial distress requires. But what happens is we can avert a crisis like a suicide. Now, just in the lockdown alone, there were 20,000 young people who experienced immense psychosocial distress leading to suicidal ideation or planning to do suicides. And I think such help immediately tries to bring somebody, because when you're all alone and you have this immense psychosocial distress in front of you, which is real, and that is the time when somebody needs to be around you. And that is time when you are at 2 in the morning or 3 in the morning. So we really request that's being put in place and please being utilized. At least we see there are 20,000 lives that could save themselves by engaging such systems. And we need more so that more deaths can be reverted. And suicide still remains our second biggest cause of death.
But most students feel that they're engaging with these systems and the system fails them. What happens when a student has really made an effort and they're not getting any joy?
So I think as much as we are a big country and exactly my point is communicating right till the 2.5 million young South Africans, the post-school system remains a massive challenge as well as an opportunity for higher health, for us to, that's why using good media platforms like yourself, making sure communication is clear so that people can get access to these telephone lines. Most of the time, students are not even aware of such help does exist. And mental health is a stigma at the end of the day. There's no doubt about it. People do not want to seek help. And we need to come out openly to talk about it's a health problem. It's a psychosocial huge both in the social world, in the health world. And we call mental health as an epidemic. It's actually a pandemic all over the world. So the reality of reaching out and seeking help is important. And I think when such systems and structures exist, it is very pertinent for every young person to please reach out at even of the things. Now, I just want to inform you that we have a curriculum on gender-based violence, which I would wanted to speak around also. But there's a curriculum on mental health that runs, and over 1 million young people in South Africa in the post-school system enrolls into it. The question is for them to enroll at such a young age is so that they can understand mental health, they can be educated on what mental health is. But one part of this peer-to-peer run program is eventually that you have to do a risk assessment at the age of 18, at the age of 19, on understanding on some of the symptoms that you might be having, and you can perceive yourself into high risk category of being mental health, so that the link can be connected. So via education, it's very critical that we start looking after an individual to self-perceive mental health risk and be connected to a healthcare provider, so that we can revert a problem at a far early stage. Then it comes to a stage when it's absolutely sometimes irreplaceable.
What conversations are taking place right now regarding gender-based violence and femicide? Are there any activations targeted at students that are in place?
So, in fact, the Minister of Higher Education launched a policy of gender-based violence in 2020. And I know we all say these are policies, and what about the real implementation that comes? But what policy has done is it's put every institution mandatory to now put infrastructure when it comes to gender-based violence. On this Friday, we are releasing, through a work of our technical task team, about 3 protocols and 3 guidelines. The one is the guidelines on procedural guidelines on sexual and gender misconduct in institutions. How to handle, what are the disciplinary systems to be put in place, what kind of infrastructure needs to be put for youth-friendly reporting systems, how do we safeguard evidence on our campuses if sexual violence does happen, issues like provision of rape kits, provision of psychosocial support structures. We are putting up a protocol on rape and sexual assault on the institution, putting a protocol on code of ethics. And these are very important instruments that now needs to be put into practice by every institution through youth-friendly infrastructure, so that GBV reporting can be possible in an easy format. GBV cases can be put through a disciplinary tribunal, which is multi-sectoral, has gender into it, and make sure that decisions are made. And decisions are made in a terminology for which justice prevails. And then working very closely with our justice system and the police and the Department of Justice, which are part of our technical task team, building these instruments in the institution. So the aim is that gender-based violence becomes a movement in post-school system. We have 16,000 foot soldiers of peer educators. We want them to support survivors. We want more survivors to come and become peer-to-peer educators in terms of grooming more and more peer to find ways of reporting early stages of diagnosis of domestic violence or abuse happening, so that a support structure can come far more quicker. The person who is suffering in a domestic violence can actually part ways far more earlier than to a situation which leads us to cases like Nosicelo. So I think this is a lot of emphasis and work, and we need to work in a multi-bilateral partnership with institutions, in stakeholders like justice, police, and then our own infrastructure in order to build this.
Let's talk about another topical issue, rape kits, post-exposure prophylaxis, counseling, etc. How is this area strengthened in terms of supporting students?
So before even I move to that answer, I just want to let you know, just like for University of Fort Hare, before University of Fort Hare, we had a massive UCT fire crisis. And when such big challenge comes to our institution, this brutal killing of Nosicelo has affected so many young lives at University of Fort Hare. So what we have done immediately from nationally is dispatched a very experienced team of psychologists and social workers and healthcare providers to University of Fort Hare. They reached on Friday, on Sunday, and they actually know how to manage group counselings, one-on-one counselings, and putting systems together and strengthening the institutional counselling units at this moment to handle this crisis, because tomorrow is a memorial. There'll be many outbursts. There'll be many people who will experience this trauma, which is actually genuinely real in the community of Fort Hare and the stakeholders and the family in general. So that is in place, and we got experienced teams built for such crisis to be managed. Then on the back end, we have now put in capacity in terms of psychologists and counselors in every rural provinces and in rural districts. Why rural? Because that's where our biggest lack is. You know, the cases like in East London, in cases in Cape Town, we hear them because social media reaches out. In fact, I won't shy of saying that there were two more suicides that happened in Umtata just about a week back in among our student community. So they were being fully, and the whole trauma that happened besides that whole thing. So the question is, this is real, this is genuine, and the aim is to put more and more infrastructure right from a rural province to peri-urban areas, and then strengthening our urban structures, which already has systems in place. So I think it's a very difficult journey. Rape test kits will become now mandatory as part of the policy, as part of these guidelines that I spoke about, because these are one of the important essential instruments that have to be in place. Post-exposure prophylaxis does exist in all the campus clinics that are in the institutions of higher learning. Whether you are in university or in TVET colleges, they are there. Not only they are for rape and cases of gender-based violence or sexual assault, but also for any accident or injury that can lead to an HIV exposure, for which a post-exposure prophylaxis within 24 hours needs to be administered.
That number on the screen, 0800 36 36 36. Just before we let you go, a quick one. Progress in terms of vaccination for students. Do we have any data here?
So absolutely. I think this is a very important point. You know, the most important thing is we are a young country, and South Africa is a young country, and Africa is a young continent, which means the trajectory of our COVID-19 pandemic will be decided in this phase of vaccination to the young people. If we young people can get vaccinated, we can quickly tame this virus, as the science has clearly shown from the perspective of how the viral loads and how the vaccine immunity will be able to overcome this huge transmission that the Delta variant loves to have from one body to the other. And young people serve as important carriers to this virus. Now, the post-school education has 2.5 million young people. So we're running on a three-pronged approach at this moment. The three-pronged approach is, the first, we have already 18 universities that already have established vaccination points in the campus. We build this for our pensioners, our staff component, anyways, when the previous phase was moving. Now, what we're doing with Department of Health in every district is and also private sector, is scaling these sites. So where we could do 200 to 300 jabs a day, now we are moving the capacity to even 1,000 to 1,500 jabs a day, which means we can now take 1,500 students per day and get vaccinated. And that's exactly where we are moving into from the university perspective. The second approach is, in TVET colleges, in rural settings, again with the district health, because we don't have many private sector partners there. With district health, what we're doing is, if not in the TVET college, just around the TVET college, we are putting up a capacity system for the students to come in. The aim is to make it more youth-friendly so that we attract more students. They don't have to miss classes, and during faculty by faculty or class by class, we can send a group of 200 students per 2 hours and get the jabs done. And of course, the third approach is where we have campuses with very low population, which is less than 2,000. It's too expensive to put capacity in it. Then what we are doing is we are tying up with the nearest occupational health site of the Department of Health and are finding hours. So for example, Saturday we devote to the TVET college and all the students, or a CET college, and the students will go and get vaccinated. So it's working on a principle of population-centered, how quickly we can do, and trying to make it more youth-friendly. And bigger youth-friendly is to get more youth access and easy access for the vaccination. So far, we've seen an outstanding response. But we also totally aware of vaccine hesitancy and vaccine refusal around at this moment. And I beg and plead from your media and parents who are listening, guardians who are listening, young people are listening. Vaccines all over the world have shown absolute effectiveness, whether it's a J&J jab you're taking or a Pfizer, because we're offering both. J&J predominantly in the rural areas and Pfizer more in the urban areas because of the cold storage perspective. They are absolutely safe. All the virus does is it loves to move from one body to the other. It keeps moving till it finds the body, sits down and starts mutating into variants. What vaccine does is exactly stopping this. What vaccine does is it boosts your immunity. Your immunity is in such a way strong that even if the virus enters because the virus can enter. Virus doesn't know whether you have vaccine or not vaccine. It will enter. But as it enters into your nose or your mouth or through your eyes or any platform inside your body, it immediately, the immunity suppresses the virus. It doesn't make it come to that kind of a huge viral load that it will start transmitting to other people or moving into your pneumonic lungs or cause you into ICU or hospitals. And data is clear. Unvaccinated people are the people who are at this moment in ICUs in the hospitals or who are dying. Vaccinate people, there's negligible death or a negligible ICU. And that's exactly what's the biggest achievement vaccines have brought. So we really appeal our young people. You are the game changer. Our trajectory of Africa will be decided through you. We are a young continent, and youth will decide the fate of how we can tame this COVID-19 as soon as possible.
Thanks once again for your time. Professor Ramneek Ahluwalia is the CEO at Higher Health. Let's take a break. We'll be back in a moment.